Hello, Clinic Review family. It's Dr. Sharon, and today we're talking about Gillian Barre, which is spelled differently than how it's pronounced for some reason. This is one of those diseases that we almost never see, but it's on the boards. So I would watch this if you're getting ready to take your Nclex. Stay tuned. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the home of the very best Nclex review in the entire universe. In my opinion, you can go to clinicreviews.com to get our online on-demand Nclex review taught by the GOAT himself, Mark Klimek. We also offer small group monthly packages for tutoring. Y'all, I don't do one-on-one tutoring anymore. Everything that I used to do for one-on-one tutoring, I basically put on the YouTube channel. I figured I could reach more people by doing it on YouTube. And that way I could interact with a lot more people. I could help a lot more people. When I was doing it one-on-one, I think I was helping people, but it was very limited and it was expensive for people to pay me to do one-on-one tutoring. So that's why I went ahead and started the YouTube channel. And we also have a streaming service. Go to clinicreviews.com to see more about that. Today we're covering the Blue Book. The Blue Book is authored by Mark Klimek. You can get it at Amazon. You can get the Blue Book app at clinicreviews.com. And this is just information that you have to know. So if people say, what do I have to know for the Nclex? Well, a lot of the information you have to know for the Nclex is in the Blue Book. So let's go ahead and get started. We're going to talk about Gillian Barre today. And you know that I teach the content in the Blue Book. If you've already got the Blue Book, you would have already studied it. But if you don't have the Blue Book, then I teach the content by going through the questions. The Blue Book does not have Nclex style questions in it. And so I write those to accompany the Blue Book. A client presents to the emergency department with complaints of weakness in the legs that has progressed to the upper body over the past few days. The client reports recent flu-like symptoms 2 weeks ago. What is the most appropriate initial nursing action? So this is a first question. All right, let me reread this because it's kind of a lot of words. A client presents the ED with complaints of weakness in the legs that has progressed to the upper body over the past few days. Okay, weakness, is that neurological? Is that musculoskeletal? It's probably neurological, because if it was they've had an injury and they said they had weakness, I would say, well, that's probably musculoskeletal. But if it's progressively getting worse, I'm thinking that's neurological. They report recent flu-like symptoms 2 weeks ago. What is the most appropriate initial nursing action? Obtain a complete set of vital signs, administer IV fluids to prevent dehydration, perform a neurological assessment focusing on motor strength, ask if the client has a history of cardiovascular disease. So one of the misconceptions on Nclex is that we should always do a full head-to-toe assessment, or that we should always do vital signs first. What the Nclex likes us to do is they like us to do focused assessment. When somebody comes in with complaints specific to a body system, our best bet is to do a focused assessment. Now, if they came in and they felt like their heart was racing and they're having trouble breathing, well, then I'd get a full set of vital signs and an EKG. But that's not what their complaints are. Their complaints are neurological in nature. So it makes sense to initially do a neurological focused assessment. Which of the following statements best describes the pathophysiology of Gillian Barre? So like I said, it's spelled a little bit differently than it's pronounced. Okay, we're talking about pathophysiology. It is caused by demyelination of motor neurons in the central nervous system. It's caused by a viral infection that directly damages peripheral nerves. It is a genetic disorder that affects the body's ability to produce myelin. It's an autoimmune disorder that attacks the myelin sheath of the peripheral nerves. So I know C is not correct. It's not a genetic disorder, so I'm going to cross that out. It is often preceded by a viral infection, but that does not mean it's caused by a viral infection. There's a very big difference between those two things. There's no evidence that it's caused by a viral infection. So I'm going to cross off B. Now the question is, both A and D talk about demyelination or attacking of the myelin sheath. D says it's an autoimmune disorder that affects the peripheral nerves. A says it's demyelination of motor neurons of the central nervous system. And it is not a central nervous system problem. It is a peripheral nervous system problem. And it is an autoimmune disorder. It does cause demyelination, but it is an autoimmune disorder and it affects the peripheral nerves, not the central nervous system. And the most common thing that you hear about is it's got ascending paralysis. So it starts in the feet and it progresses up. Sometimes it doesn't get any higher than the waist. Sometimes it can go all the way up. So worst case scenario, it can cause respiratory failure. Best case scenario, causes some weakness in the legs. If it goes up higher, it can cause incontinence. And then depending on where it goes up to, you're going to have problems. So that's the thing. A client with Guillain-Barre asked the nurse about their recovery. The nurse should base their response on which understanding about the recovery process. Most clients recover within 1 to 2 weeks of symptom onset. I know that's not true. Recovery usually occurs within 2 to 4 weeks, but may take longer in severe cases. Recovery typically begins after several months, with most clients regaining full strength within 2 years, and recovery is uncertain, and most clients experiencing long-term disability. So I know D is not true. It is a reversible disorder, interestingly enough, even though it's autoimmune, it is sort of reversible. So the question is it a 2-week event that can take longer, or is it pretty much for everybody months with years? And y'all, the answer is months to years. So this is a significant issue. People have long-term recovery from this because they're going to become quite debilitated, physically debilitated, motor muscle debilitated because of the motor weakness. And they're going to be in rehab and so forth. They may be on a vent for a while, depending on how high it goes. And so forth. So it is a significant illness that takes months to years to recover from. A client diagnosed with Guillain-Barre syndrome is admitted to the ICU. Which of the following treatments should the nurse anticipate as part of the medical management? Plasma exchange, which is plasmapheresis, high-dose corticosteroids, antibiotic therapy, surgery to repair damaged nerves. Well, it's not an infection, so we can cross out C. And there's no surgery for it. So the question is, are corticosteroids used? And corticosteroids are used for a lot of autoimmune disorders, y'all, but not in this one. Okay, it's used immunoglobulins and plasma exchange or plasmapheresis is used. And there's a question coming up about what this is. So I'm not going to tell you what it is, but the primary treatment is plasmapheresis. A nurse is assessing a client with newly diagnosed Guillain-Barre. Which recent event in the client's history is most likely to have contributed to the development of this condition? So I told you it's often preceded by a viral infection. A recent streptococcal throat infection, so streptococcus is not viral. Recent flu vaccine, the flu is viral. So is it a live vaccine? If we're given the live vaccine, it could be that. Recent cardiac surgery, no. Recent diagnosis of diabetes. I mean, I guess you could argue that sometimes diabetes is preceded by a viral infection. And if they had a viral infection that preceded diabetes, then that could also cause Guillain-Barre. But that's just not reality. That's just not the way it works. So you would have to say there's a direct relationship between diabetes and Guillain-Barre. And there's no relationship between diabetes and Guillain-Barre. So we're going to have to cross off C and D. And A is not viral. So the question is, can a recent flu vaccine be a precursor for Guillain-Barre? Y'all, I'm not here to tell you to take your vaccines or not to take your vaccines. I'm just telling you that if you get a live vaccine, virus vaccine like the flu, that have some evidence to precede some Guillain-Barre syndrome. The nurse is monitoring a client with Guillain-Barre in the intensive care. Which of the following complications should the nurse be most concerned about? Respiratory failure, cardiac arrhythmias, hyperkalemia, or kidney failure? So the kidneys are not affected by motor neurons, peripheral motor neurons. The potassium level is not affected by peripheral motor neurons, and cardiac arrhythmias are not affected by peripheral motor neurons. In fact, the heart, even with a major spinal cord injury, the heart's going to keep beating because it has an inherent pacemaker. The pacemaker of the heart is inside the heart. So unless the pacemaker that's inside the heart is killed off through lack of oxygenation, the heart's going to keep beating even if you lose peripheral motor function. So it's only the lungs that are affected by the peripheral motor neurons. And so that's the one that you have to be most concerned about out of these four. A client with Guillain-Barre is scheduled for plasmapheresis. Which explanation should the nurse provide to the client regarding this procedure? This procedure removes the damaged myelin from your nerves. No, that's not true. So remember, it's an autoimmune disorder, which means the immune system is attacking the myelin. So You do have demyelination going on, but the plasmapheresis doesn't do anything to the myelin. This procedure will provide your body with extra antibodies to fight off infection. It doesn't sound right, but maybe. Plasmapheresis will repair the nerve damage caused by the syndrome. No. Plasmapheresis removes antibodies from the bloodstream that are attacking your nerves. That one sounds right, okay? The other type of treatment, not corticosteroids, but the other type of treatment that we can do is called IgG, giving IgG antibodies, which is immunoglobulin therapy. And that is actually giving antibodies from healthy donors. Okay, so plasmapheresis removes the antibodies that are attacking your nerves, and IgG gives healthy antibodies from healthy donors. Okay, so those are the two primary treatments for Guillain-Barre. A nurse is caring for a client with Guillain-Barre who's experiencing dysphagia and difficulty clearing secretions. So they're having trouble swallowing and getting the secretions out. What is the most appropriate nursing action? Elevate the head of the bed to 90 degrees during meals. Well, I would want to do that. Consult a speech therapist to assess swallowing function. I would want to do that. Prepare the client for immediate intubation. No, that's not the highest priority right now. Administer IV fluids to prevent dehydration. That's not the highest priority right now. So I'm going to cross off C and D. So most appropriate is best. So I've got two. Do I want to elevate their head of the bed while eating, or do I want to consult a speech therapist? And I want to do both. So which one is best? So what they want to know is, do you understand fundamentally what's the most important thing to do here? They're having trouble swallowing, clearing secretion. So what I do is I say, well, I'm going to elevate the head of the bed during meals, but I'm not going to have speech therapy come in and assess their swallowing, which doesn't sound like a good idea. Or I'm going to consult speech therapy to assess their swallowing, but not elevate their head of the bed 90 degrees. Yeah, I have to consult speech therapy to assess their swallowing. They have to have a swallowing eval. Now, if it said complete a swallowing evaluation, that would be the right answer too. Okay, so I wouldn't have to pick between A, do a swallowing eval, and B, consult a speech therapist to do a swallowing eval. Like a swallowing eval needs to be done, whether it's me doing it or the speech therapist doing it. That's what absolutely has to be done. So I don't want to be, I don't go, well, I can just put their head up and feed them. It'll be okay. No. That's not okay. We need to figure out how they're doing swallowing. Client with Guillain-Barre is being monitored for signs of disease progression. Which of the following assessments is the most important for the nurse to assess every 2 hours? So Guillain-Barre is a problem with the motor neurons being demyelinated, and so the muscles aren't working right. So blood pressure, maybe, but those aren't really affected by the motor neurons. Peripheral pulses, not affected by motor neurons. Respiratory rate and effort, that would be affected by the motor neurons. Reflexes, well, reflexes could be affected by the motor neurons, so that could happen. But I have to say what's most important. So am I more concerned about reflexes, or am I most concerned about breathing? Well, that seems pretty obvious that I'd be most concerned about breathing, and that I'd assess that every 2 hours. Okay, so I hope that was helpful. Guillain-Barre is a progressive autoimmune disorder that is characterized by ascending paralysis. And as it ascends, they can have difficulty walking. They may trip and fall. Sometimes they go, I don't know why I'm tripping and falling all the time. They can have incontinence. And as it gets higher, they can start to have difficulty breathing. They could, worst case scenario, end up on the ventilator for several months if it doesn't recede very quickly. And then they can have a long pattern of rehabilitation. So that's kind of worst case scenario. It is possible to have some lingering effects if they're not, because, if they're debilitated and on a ventilator for several months, there could be long-term effects from that, right? Even if the disease itself is kind of recedes, they could still have long-term implications just from being so debilitated for so long. So that's Guillain-Barre. It's not that difficult to remember. It seems like every nurse knows Guillain-Barre. I don't know why we all have to know Guillain-Barre, but it seems like we do. I've been a med surge, mostly cardiac, but med surge nurse for 30 plus years. And I think I've only taken care of one patient who's being worked up for Guillain-Barre, and they did not end up having Guillain-Barre. Now, I will admit, I mostly work cardiovascular, so that could have some reason why I haven't seen it as much. If I worked like neuro ICU, I might have seen it more often, but it's just not something I see much, but it seems like every nurse has to know about it. So love you guys. Hope you do well on your Nclex, your standardized test that you have to take to graduate. And thanks for being a part of the Clinic Review family.